Namaste. The objective of today's presentation is to bring out an occult cause behind failed induction of labor based on the Ayurvedic standpoint. Induction of labor is medical stimulation of uterine contractions before labor begins on its own, usually to favor vaginal delivery. Cases or conditions requiring induction of labor are postterm pregnancies, that is beyond 42 weeks, premature rupture of membranes, medical conditions of mother like preeclampsia, hypertension, gestational diabetes, infection within the uterus, and fetal concerns like fetal growth restriction, insufficient amniotic fluid. Various methods of induction are usage of prostaglandins like cervical ripening gel, artificial rupture of membranes, usage of oxytocin drip, mechanical methods like usage of Foley catheter for cervical dilation, and membrane striping. Though there are these many methods for induction of labor, there are certain causes or risk factors which are responsible for failed induction of labor, described by Western medical science. They are as follows: unfavorable cervix, advanced maternal age, obesity or high BMI of mother, fetal factors like macrosomia, and premature rupture of membranes. While these are the macro causes described at gross level by Western medical science, what is the occult micro cause behind failed induction of labor operating at ultra fine level according to Ayurveda? To find out the answer for this question, we'll have to take up two tasks. Number one, analysis of cases or conditions requiring induction of labor described by Western medical science according to Ayurveda, and analysis of causes for failed induction of labor described by Western medical science according to Ayurveda. Taking up the first task, that is gross analysis of cases requiring induction of labor according to Western medical science through the lens of Ayurveda. Condition number one, post-date pregnancy. This is nothing but Atita Kala Garbha as described in Upavishtaka or Nagodara, or Apravartana of Prasava, which is attributed to karma of Kupita Vata. Condition number two, premature rupture of membranes. This is Ati Shighra Munchana of Garbhodaka caused by Kupita Vata, because as a known thing, Munchana and Dharana are karmas of Vata. Condition number three, medical conditions like preeclampsia, hypertension, gestational diabetes. These are the vyadhis which involve Kupita Vata in Samprapti. They may either be in the state of causative factor, or Vata Kopa might be the result of Vyadhi Samprapti. Number four, fetal concerns like fetal growth restriction, insufficient amniotic fluid. Both these involve Shoshana and Rukshana, which is again the karma of Kupita Vata. Number five, infection within the uterus. This causes dushti in apanasthana regardless of the causative factor. So, deduction from analysis of cases requiring induction of labor are: Apanavata seems to be in Viguna or Kupita Avastha in cases requiring induction of labor in majority of the times. So, the untreated Kupita Vata itself would be the cause for failed induction of labor in majority of cases according to Ayurveda. And fortunately, if Vata Vaigunya gets addressed unintendedly or intentionally by food and lifestyle of patient or through proper medicines, in cases requiring induction of labor, failure of induction would be prevented in cases where Vikrita Vata is the cause for failed induction of labor. Task number 2. Deciphering the causes for failed induction of labor which are described by Western medical science through the lens of Ayurveda. Cause number 1. Unfavorable cervix or unresponsive cervix. It's nothing but inability to become vivrita or asamvedanashilata of an avayava, again caused by viguna vata. Number 2, advanced maternal age. Low grade sputatva in srotas and low dhatusara in advanced maternal age again results in kopa of vata or vata vaigunya. Number 3, obesity or high BMI results in viguna vata by upachaya of medo dhatu alone and meda savrata margatva of sharira as described in Staulya. Number 4, fatal factors like macrosomia results in viguna vata by margavarodha caused by huge baby. Number 5, premature rupture of membranes results in viguna vata again by sudden kshaya of garbhodaka dhatu kshaya and tatjanya kshobha. So inference from analyzing the causes for failed induction of labor according to Ayurveda are: grossly, failed induction is failed pravartana of prasava. Failed pravartana as a known thing is viguna apana vata karma. Viguna apana can be resulted from dhatu kshaya as in premature rupture of membranes or by margavarodha as in obesity, BMI or macrosomia, etc. Viguna vata itself is the occult micro cause behind all macro causes of failed induction of labor. The other noteworthy entity here is that apana in vigunavastha might be present before pregnancy or it might have occurred during pregnancy due to improper paricharya in garbhini avastha. So the essence of this presentation is that measures to retain vata in prakritavastha mentioned in Ayurvedic classics, especially those mentioned in Garbhini Paricharya, mainly maintaining proper snehana throughout pregnancy by intake of snigdha ahara throughout pregnancy, placement of yoni pichu at proper trimester, and administration of basti, at least matra basti, at proper time, prevents the necessity of inducing labor and also prevents the failure of labor induction in cases where viguna apana would be the cause for failed labor induction. So, administration of a course of snehana by case-specific appropriate method of snehana before inducing labor prevents failed induction of labor in cases where viguna apana vata is the cause for failed induction of labor. The other main thing which should be remembered here is that the key points which are described in this presentation, like viguna apana being the cause for failed induction of labor in majority of cases, and the ideology of correcting kupita vata preventing failed induction of labor, gets validated only when rogi and roga pariksha is meticulously done on Dashavida Pariksha and based on Nidana Panchaka respectively, and not merely by drawing parallels for those factors which are mentioned by Western medical science. Thank you.